Vanessa Mashanya in rural West Virginia. And when you live in a rural area like this, what you gain in green spaces and natural beauty, you lose out on in the areas of accessibility and public transportation. And there's a lot of folks who live in areas just like this one who have trouble getting from point A to their doctor's appointments and rely heavily on the services of volunteer drivers to get them where they need to go. But unfortunately, nationwide, finding those drivers is becoming increasingly harder to do.
As long as you have the key in your hand, it opens for you. And
it's hard to miss.
Yeah.
In his bright green car, Bob Yoke is ready for anything.
Jumper cables, we have tire tools.
He's prepared for it all because when he drives, where he does, and who he does, he knows his mission is just too important.
A lot of them wouldn't have any way to get here.
Bob is one of the many volunteer drivers across America who take patients through hundreds of miles of winding country roads to medical services. He's been doing it for more than 2 decades.
The best non-paying job I've ever had in my life.
Specifically, Bob shuttles veterans in West Virginia at the Clarksburg VA hospital. This kind of work is not only a kind gesture, but a necessary service for seniors, vets or not, nationwide, who otherwise do not have any physical access to health care.
A lot of times I just get to listen to somebody tell me about how he has to go to the top of the hill to use his cell phone and tells me about his chickens and things.
Barbara Brown is the maestro behind the scenes here, connecting her team of drivers like Bob to patients in rural areas needing a ride, sometimes several hours away.
Some of the rural folks, they may not be able to afford a vehicle, especially at this time.
Her job, though, is getting tougher.
They're just far and few between getting them. It's like pulling teeth.
National Rural Health advocates say the long distances folks in these areas have to travel for health care, the funding hurdles rural hospitals are going through, and the low numbers of volunteers to drive patients interrupt the speed at which they receive care. If volunteers cannot fit the need, ambulances usually pick up the slack, which can impede response times in case of emergencies.
We're seeing a number of volunteer services and other ambulance operations having to cease their operations.
The fleet of green cars Clarksburg uses are courtesy of the Disabled American Veterans Charity, so folks like Bob don't have to rely on their own cash or cars to do the work. That's not the case for every volunteer, though. The federal government reimburses volunteers 14 cents a gallon, but that charitable rate hasn't been raised by Congress since 1997. Another issue, the volunteer workforce, which relies heavily on retirees, is aging out.
We've carried a little over 3,000 passengers so far, so the numbers are adding up.
Bob may not be planning on stopping anytime soon, but he knows he will have to one day, and hopes that more people choose to get behind the wheel, helping rural neighbors in need, because just like it has for him, it might just turn from a nice deed into a calling.
You really get attached to them over the years, so it's really a rewarding job.
In Clarksburg, West Virginia, I'm Vanessa Mashanya.
A growing number of parents say worries about their kids' mental health is impacting their work. We'll show you the help some want companies to offer next on The Race.